Okay, this video is about gastroesophageal reflux disease, GERD, esophagitis, drinking tea, and eating spicy foods. What got me motivated was a reader asked me about, the dangers of eating spicy foods. And I had in the past read a very good newsletter by Dr. Mcdougall about gastroesophageal reflux disease, and I wanted to get back to going over it in more detail. So anyways, here it is. This is called the Scoville scale of how hot a spicy food is. And, capsaicin, pure capsaicin is super hot, activation of the heat receptors. And there's this whole scale here. Me personally, I never had that much of an interest in spicy foods. It's like, why induce pain in your mouth? Okay, it doesn't mean much to me. Cleveland Clinic has a little bit of an article on spicy foods, how they can be associated with gastroesophageal reflux and some other problems. There wasn't that much literature on it, but I did find a few things, sort of in the PubMed papers. Okay, here's one PubMed paper showing GERD, gastroesophageal reflux disease, associated with high-fat diets, with fried foods, citrus fruits, carbonated drinks, spicy foods, and salty foods. And the key thing I think of is just abdominal pressure syndrome as described by Dennis Burkitt. Basically, when you're constipated because you don't have fiber in your diet, that means your stools are small. You're defecating goat pellets and hard Tootsie Rolls rather than cow patties. The defecation is a reflux whereby you distend the rectum with soft liquid stool that puffs it out, and then you get a reflux contraction to defecate. Versus when you got goat pellets in your rectum, they don't stretch the walls very much, and so you'll have to strain, tighten up your abdominal muscles. That's called Valsalva maneuver. And the back pressure, some of it's transmitted to the stomach, and over time it keeps pressurizing the hiatus in the diaphragm. That's the hole through which the esophagus connects to the stomach. And over time it enlarges that hole, and the stomach starts to pouch into the chest. That's called hiatal hernia. Then you get acid reflux into it, and that acid reflux will change the histological layers of it, the cell layers, and you'll get something called Barrett's esophagus. It's a transformation of the epithelium, the lining. Anyways, that'll cause pain. Pain behind the sternum is called heartburn. The acid can reflux higher up into the esophagus, into your lungs, can cause asthma, into your voice box, your larynx, and that'll cause a hoarse voice. Chronic voice hoarseness can occur from that. Can go into your mouth, cause dental cavities, especially if you really have, an intentional problem with bulimia. About 5% of college girls apparently have that. I remember I had the daughter of a friend of my parents had that. Real pretty girl, but it's a little crazy. We were playing around at her house when we were kids, and we ran around. And she had all these plates, all kinds of things hidden all over her bedroom where she was hiding food. Anyways, it can cause cavities. It can even cause sinusitis. So what do? You just eat more high fiber food, which is low fat plant foods, and you'll poop out cow patties. You'll be better off there. Okay, so now we'll go into some more details. We'll get to Mcdougall's. Here's Mcdougall's newsletter. If you want to look up Mcdougall's newsletter, you go to the drmcdougall.com website and just type in GERD, where you can look for this newsletter. It was updated February 2024. It was originally a February 2002 newsletter. It's very good and it's very detailed. We're not going to go into that level of detail here with this presentation. Other risk factors for gastroesophageal reflux and reflux esophagitis. Itis just means inflammation, so esophagitis is just inflammation of the esophagus. Being older, a little worse in men according to this paper. And tea drinking. I saw tea drinking in a couple other places. They do mention greasy food, and they mention constipation. Of course, there's abdominal pressure syndrome. One of the things you notice is they seldom ever put anything all together. Here's the way your stomach looks. Your esophagus comes down from your chest, connects to the stomach, and then it goes into the stomach here. This is the fundus of the stomach, the gastric body, gastric antrum, the pylorus, and it dumps into the duodenum. The point of the matter is that it always dumps to the right. I've seen thousands and thousands and thousands of stomachs. They always dump this way. So what's the point? When you first lay down to sleep, you want to lay with your right side down. So you want this side down when you first sleep. That way your stomach empties out and you're less prone to reflux. That also tends to be the best position for sleeping for most people. Okay, another paper. The fatter you are, the more likely you're going to have esophageal reflux. So fat BMI is directly proportional to erosive esophagitis. Okay, here's another paper. Consumption of hot beverages and foods. I don't like it when a food's too hot. If you're drinking really hot coffee or something, or the food's really hot, I want it to cool off. Okay, like if my rice is too hot, I'll put it in cold water. Okay, I'll pour some cold water on it. Reverse osmosis cold water. Okay, hot beverage and food consumption associated with increased risk of esophageal cancer eventually, if you do that all the time. Okay, now we'll go through some of the stuff from Dr. Mcdougall newsletter at his drmcdougall.com website. The name of his newsletter is also called My Stomach's on Fire and I Can't Put It Out. So like I said, when that acid goes upward, it can do a lot of damage. It can erode the esophagus, besides causing heartburn pain, can, if chronic for decades, can lead to esophageal cancer, can even cause sinusitis. We talked about the bulimia, ulcerations in the mouth, can affect the larynx, the voice box, cause laryngitis, and lead to a chronic hoarse voice. Can lead to a chronic cough. I see a lot of patients with chronic cough that can be associated with this. Bronchitis, asthma. About 75% of children with asthma have GERD. GERD is associated with, of course, abdominal pressure syndrome, APS, as described by Dennis Burkitt, associated with the hiatal hernia, like we talked about. It's worse with foods that open up the LES. LES is lower esophageal sphincter, meaning the sphincter that separates the esophagus from the stomach. When it opens up abnormally, then acid is able to pass upward into the esophagus and potentially higher than that. I see tons and tons of patients with gastroesophageal reflux disease. It's super common. A typical American only eats about 5 or 10 grams a day of fiber. Burkitt said our ancestors were eating over 100 grams a day. Mcdougall says we should get at least 40 grams per day. I've heard other sources say try to get at least 50. Okay, but anyways, if you eat plant foods, you'll get that pretty easy. All plant foods have fiber because fiber is part of the cell wall of the individual cell, so it's always there in a plant food. Versus in an animal food, there's no fiber, zero. Okay, dairy is also a problem. Dairy can paralyze bowel peristalsis and cause increased constipation, leading to more abdominal pressure syndrome. It also thickens the mucus in your sinuses. Like if you're ever going to give a talk, you don't want to be drinking dairy before you're going to give the talk. It is a good idea to hydrate before you orate, but you can hydrate with water or you can hydrate with beet juice, chase it down with water. I like to do that. Okay, dairy, we talked about that. Increased lower esophageal sphincter, LES patency, and GERD. Things that'll do it, foods that'll cause it. High-fat diets, chocolate, uncooked onions, radishes, peppermint, mints, spicy foods, some of these other things. Coffee is a bad one. You want to quit coffee, including decaf. Cigarette smoking, alcohol, they're all bad, bad, bad. Some medications will do it. We're not going to get into all the meds, but some will do it. You can look them up. I recommend, if you're interested in this, go to Dr. Mcdougall's newsletter and look it up. You'll be surprised. It's excellent. It's the best thing I've ever seen written on this subject. Some medications that are used to treat GERD. What does Dr. Mcdougall recommend? Eat a low-fat vegan diet, starch-based with no oils. It's high in fiber. Okay, that's how you help prevent leaky gut. That's how you prevent constipation. Avoid foods that cause GERD. Okay, we just talked about them up here. Quit your coffee. Avoid the meds that cause it. Eat smaller meals so you don't overfill your stomach, which makes it more prone to reflux upward. Optimize your body weight. That goes along with optimizing your health and comes from eating a low-fat vegan diet. You can initially elevate the head of your bed about 4 to 6 inches. You can put a little something underneath the head part of the bed. So anyways, I hope that was helpful to you.